digital transformation of Indian healthcare industry by Dr. Sujata Malik, who is the CEO and the Managing Director of Sunburst Healthcare Pvt. Limited. And she's joining us from Hong Kong. It is, I think, 8:30 kind of thing in Hong Kong. Thank you so much, ma'am, joining us. And before I hand over the platform to her, let me have the pleasure of introducing her. She comes with a very rich experience of being a medical practitioner and medical administrator, most importantly. After completing her MBBS from Government Medical College in Jabalpur between 1978 and 1984, right? She also has done her two other studies. One is postgraduate diploma in hospital and healthcare management from Symbiosis Institute of Health Sciences, and also Bachelor of Medicine, medicine or surgery from Symbiosis Institute of Healthcare Management, Pune. And if you look at her, professional experience, she started her career with Jahangir Hospital, Pune, as deputy medical superintendent. Then she went on to work as director of medical services at Ruby Hall Clinic. And after that, she was the medical director at Sakra World Hospital, Bangalore. And after that, she was again with Jahangir Hospital, Pune, as the director of medical strategy and development. And currently, she holds three positions simultaneously. One is being a healthcare consultant for Bajaj Finserv, that she's serving from March 2019. And she has been the CEO and managing director of Sunburst Healthcare Pvt. Limited from October 2017. And the third one is she also is a managing partner for Iconic Healthcare from December 2020. So as you can see, she wears multiple hats, and she's here today, joining us from Hong Kong and talking to us from on this topic. And most importantly, she is an experienced medical director, skilled in healthcare consulting, healthcare information technology, electronic medical records, clinical research, and medical education, and strong healthcare services with professional, graduated from Symbiosis Institute of Healthcare Management, Pune. And happy to have you, ma'am. And sorry to disturb you, Saturday evening, but absolute pleasure to have you. And let me share the screen for you.
Thank you. It's an absolute pleasure being here. And so basically, I'm a healthcare professional with more than 30 years of experience in the healthcare industry. I am extremely grateful to the organizers for having invited me here today. During my career, I wore many hats. I was a clinician in the Indian Army, went on to manage large quaternary care hospitals, did some healthcare consulting, and then founded my own home healthcare company. Basically, the company is it has a stated aim of making healthcare more accessible and affordable to our clients. In this talk, we will be touching upon how digital technology is changing the way healthcare is being delivered and disrupting the Indian healthcare scene. We will discuss the emerging scenarios in society which are making speedy adoption of technology imperative. We will look at various use cases and facets of technology, and the challenges in adoption of technology. We will discuss the National Digital Health Mission launched by the Government of India and the legal framework for collection, storage, retention, and communication of digital health data. Finally, we will see an overview of what the healthcare of the future will look like. So this will be the structure of the talk today. There are certain emerging healthcare trends which are making speedy adoption of technology a necessity. Speedy healthcare problems of a couple of decades ago are actually not the burning problems of today. Healthcare is advancing as a science, and earlier it was about malnutrition, about infectious diseases. Today, the burning issues are lifestyle diseases like diabetes, hypertension, coronary artery diseases, and also cancer. So cost of healthcare is spiraling out of control. It is no longer feasible to pay for healthcare from your own resources. Insurance and other payers are penetrating the market rapidly. And this means that the records have to be maintained and accessed and shared in real time. Government mandates and policies also require data to be maintained and shared as per regulations. Consumers are much more empowered and are not merely passive recipients of care. They want full understanding of their healthcare conditions and the treatment options that are open to them. They are active decision makers in the process of accessing healthcare. Finally, scientific advances in healthcare are driven by digital technology. Use of AI and machine learning models has made these devices very efficient and user friendly. So to put things in perspective, these are some statistics which will tell us why a change is absolutely imperative. By 2050, 1 in 5 Indians will be more than 60 years old. We earlier had a young population because of our high birth rate, but slowly this is changing. And what is happening is that even the developing countries, actually the life expectancy is increasing and patients are living longer. And today the life expectancy in India is 70.15 years. 86% of all spending on healthcare is now due to chronic diseases. So 10.1 crore Indians suffer from diabetes. We have the dubious distinction of being the diabetes capital of the world, and 14.5 lakh cancer patients are added every year. And this makes the healthcare, this stretches the healthcare system and makes it very difficult to uh, to um, to give healthcare. It should be healthcare would be very difficult to access if so many patients are in the scenario who are suffering from diabetes and cancers, and therefore there is a paradigm shift from diagnose and treat to prevent and manage. New situations call for new solutions. Urgent measures are needed to bring down the cost of healthcare. The focus is on prevention and management of diseases through lifestyle changes and better treatment compliance on an ongoing basis rather than episodic health. What was happening earlier is you went to the doctor when you had a problem, and if there was a catastrophe, you went to the doctor, you got yourself treated, the treatment was very expensive, you went back, and then again you fell out of the monitoring, and the cycle would get repeated. So today, rather than episodic healthcare, the focus is on diagnosing and treating disease conditions only. The home is therefore the ideal environment for healthcare delivery to a large extent. The home bed is free, and the caregivers do not waste time on long commutes. The patient is more comfortable. The hospital-acquired infections are totally avoided. Cost of healthcare is therefore brought down. And also, what is seen is that the outcomes are much better with this kind of scenario. Remote rural areas in countries like India should get access to state-of-the-art healthcare, and the shortage of qualified healthcare personnel could be uh, overcome to an extent. The focus is on shifting from adding new beds to developing services to provide improved access and quality of care at a lower cost. Another driver of digital technology in healthcare is the omnipresent smartphone. So everybody has a smartphone. In countries like India, there is about 80% penetration of smartphone. Everybody can therefore access digital technology at the touch of a button, and this makes it accessible for patients who can then use healthcare apps, and therefore control their own health in a better way. Since it has the ease of mobility, it is rapidly becoming a chosen medium of healthcare delivery and coordination. There are growing number of mobile-based healthcare apps. mHealth should be broadly classified into 4 main types. So the single-use mobile health, where a single consumer has an application for a single use. He would then monitor his own parameters, and they could be communicated to others. And so these are consumer-centric apps, and they would focus on uh, on better access to healthcare, and they would focus on wellness, diet, and exercise. So social health is what basically the applications which where the uh, the um, uh, the clientele or the people who are using the apps can interact among each other and draw upon the support of and encouragement of which is provided through social networks, gamification, um, and uh, and competition-based apps, which encourages users to meet healthcare goals. Integrated mobile health. Here, the apps with devices are basically with the formal healthcare system, and these are devices which talk to the formal healthcare system. The healthcare providers are able to access data which is generated out of these apps, and these are tailored to multiple end users like consumers, physicians, and administrators. The complex health is where there are data analytics which are generated from these applications, and focus is on achieving optimal management of a specific disease. So, gap in access to healthcare. Uh, the insurance penetration, the healthcare is not uniformly accessible to all sections and strata of society. Penetration of health insurance coverage is less than 1% of the population. Healthcare resources are still not commensurate with our huge population. We have a bleak patient to bed ratio of 1.3 is to 1,000, which is way below the WHO prescribed patient bed ratio of 3 per 1,000. Patient to doctor ratio is also below the international standards. There is a gross disparity between rural and urban populations with respect to availability of healthcare resources. So there are 4 major themes that are emerging in digital transformation. Smart care. What it means is the robotics and automation, which make precision and personalized care a reality. The care anywhere, where patients are monitored within their homes, and therefore they are connected continuously to the healthcare, the formal healthcare system, and responses can be tailored to any kind of changes in the patient's condition as while he's being monitored at home. This has become possible with the advent of digital technology in healthcare. Empowered care. The patients are now, they can monitor their health parameters, and they would know when their parameters are going out of the appropriate ranges, and they would be able to access healthcare whenever necessary. And so this is called empowered care. The patient has control over his own healthcare. Intelligent health enterprises. These are a wide variety of tech-enabled enterprises. They use AI and ML to make valuable contribution to healthcare of population at large. They create equipments, devices, personalized care plans, and drug discovery systems based on the above models. So the demand-supply gap can be bridged by use of the digital technology, and shifting care closer to home can broaden the access to healthcare and reduce the strain on overstretched healthcare systems. Telemedicine and teleradiology. There was a time when we were, telemedicine was absolutely, it was available for last 2-3 decades, but before the pandemic, nobody really gave so much thought to it and never used it for formal healthcare access. However, when the pandemic came, doctors were not available to see patients, and therefore it became a norm, and patients accessed healthcare through telemedicine. In fact, Sunburst Healthcare actually went ahead and offered packages of 14 days to patients across India, And we found that the outcomes were extremely good, and the patients actually did not need hospitalization to a large extent. Some needed hospitalization for administering remdesivir, but they came back unscathed. Our oldest healthcare, our oldest patient was a 93-year-old lady, and we were able to administer extremely um, um, effective healthcare through telemedicine. Telemedicine market in India is valued at 1.1 billion USD in 2021, doubled in 2023 to more than 2.5 billion USD. It is estimated to expand at a CAGR of 21.2%. The potential to bridge rural-urban divide is there with telemedicine. Doctors sitting in urban areas can administer healthcare to populations who do not have such access to healthcare, and cost-effective and easily accessible services are actually available to patients in different geographies. So the wearables, these are used to monitor and promote good health and provide continued. Can you please change the slide? Yeah. So to provide continued management of lifestyle diseases and better compliance to treatment. So common biosensing wearables are contact lenses that monitor glucose level, smart pills that can monitor medication intaking behaviors and body response. The hearing devices also, which can boost hearing, a heart rate monitor patch, and wristbands to monitor heart rate, BP, calories. These are the regular watches which are available, and insole sensors which measure weight bearing, balance, and temperature. A large number of intelligent wearable devices with biosensing capabilities are into the market, and recent innovation includes fabrics which are impregnated with sensors. Wearables work in conjunction with software applications. They are unobtrusive. The patient can move around easily, and there will not be any difficulty. The cost of treatment comes down drastically using wearables, and this was established by IASD case study, which was undertaken in Stanford. And so the data that was generated in the EMR of Mercy Hospital actually showed us that personalized care plans, which can be accessed by physicians and nurses, and the project is likely to yield huge benefits. So home healthcare and IoT devices. So patients are monitored in the home with these devices. They are connected to the virtual healthcare team sitting in hospitals and various centers. And they are basically, the home bed is free. The ER visits can be easily avoided. So it has been noticed that when a patient comes in an emergency, that is a time that there are major healthcare costs involved, and hence if you are monitoring the patients carefully at home, the incidence of ER visits comes down, and therefore the cost of treatment also comes down, and the outcomes are improved. So empowered care. Smart sensors, cloud applications, maturing analytics are being used to provide living services. Consumers are able to make lifestyle changes and prevent onset of diseases. They are empowered to make the right healthcare choices and manage their own health. Early warning signs could be picked up by patients and caregivers, and prompt, timely management could be brought about, and thus helping prevent or reduce ER admissions and save significant costs. Specific digital apps are now available for the management of lifestyle diseases like diabetes, COPD, atrial fibrillation, hypertension, and so on. Number of apps for diabetes management are growing rapidly. Pharmaceutical companies are coming up with apps to enable treatment compliance, study patient response to medication, and to support research. Patients are no longer passive recipients of care, but are actively involved and engaged in managing their own wellness and healthcare. So the EMR, which has now become an omnipresent um, uh, a factor across all hospitals and healthcare systems. This is the electronic medical records. All healthcare systems are now generating electronic medical records, and there are healthcare management information systems which are generating a lot of data. The availability of records across geographies is very much possible. Interoperative healthcare equipment is interoperable healthcare equipment is available, and it talks to the electronic medical records. Hence, using this data which is generated, a large number of patients can actually access healthcare the way that they want. They can share the data the way that they want, and so on. Robotics and automation in healthcare. So precise surgeries are possible using robotics. Assistive rehabilitation devices are again absolutely making their appearance, and patients are able to improve their function using assistive rehabilitation devices or the robotics. Automated diagnostics are actually improving the way laboratories are functioning. Streamlined administrative tasks are also possible to implement. For instance, there could be robots which are used to refill the medications, the prescriptions, or they could be used for management of stores, and therefore improve administrative tasks. Precision medicine, robotics, and medical printing are making healthcare smarter and more personalized. So this is the Da Vinci robot. The surgeon is sitting here. The assistant is here, and the images are displayed on this monitor. And this is the way that the robots are now being used. Actually, it is also a possibility that remote surgeries might start happening once the infrastructure, the digital connectivity is improved. It is possible that one may be able to do remote surgeries. 3D printing and revolutionizing of healthcare is a possibility. Basically, anatomical modeling for diagnosis and education. 3D printed models, which will help in modeling for diagnosis and education. Surgical planning can be done. For instance, if there is a CT scan or a MRI of a patient, then this can be used to generate 3D models, and then the surgeon can plan beforehand what approach is to be used to access the tumor and to operate, and this improves the care of patients, and it is something that people are now looking at. Customized implants and prosthetics are available. They are all 3D printed, and therefore they are more efficient. Drug delivery systems which deliver medicines, which are also which release medicines which are 3D printed and release medicines at different rates. Dental implants, these would become 3D printed dental implants would be much better, more efficient, and will give better results. Bioprinter printed urinary bladder is so far the only 3D printed organ which has been transplanted. This was done in 1997 by the Wake Forest Institute of Regenerative Medicine in the US. This was done in 1997, and the organ is still functioning without any problem. The future is actually mass production of working human limbs, replacement of joint cartilages, and transplant ready organs. So genetics and DNA profiling for predictive healthcare is another spin-off of digital technology in healthcare. In fact, earlier on, when this technology was very expensive, it was most people could not access it. Today, a genome can be completely analyzed using and DNA profiling can be done, and this would not cost more than $100, and therefore the illnesses can be predicted and managed and controlled. Mutations can be recognized early on. Digital diseases like Down syndrome, spina bifida can be predicted before birth. In future, rewriting of faulty DNA and modifying immune cells will be possible. And therefore, intelligent health enterprises, basically big data analytics and artificial intelligence and machine learning enabled devices can help in predicting onset of diseases, their course, and help in planning, prevention, and management strategies, and driving behavioral change and lifestyle modification based on risk profile of patients. More appropriate and personalized care can thus be given and will reduce costs due to futile care. So since there is information available and it is being analyzed, so the personalized care can be given, and this will reduce the cost of care which is not necessary or will not have the desired results. The predictive analytics market is likely to be $10 billion in 2023, and in 2032 it would become 35 billion. The CAGR is of 30%, and therefore this market is rapidly growing. So AI in healthcare, the diagnosis of patients using AI, drug discovery and development, improved physician-patient relationship is a possibility using AI, because if you deliver good results, then the physician-patient relationship is improved. Transcription of medical documents is also possible using AI. Natural language progression, or NLP, is a technology which is being used to help transcribe medical documents. Treatment protocol development can be helped by AI. Personalized medicine and patient monitoring and care are other uses of AI in healthcare. Machine learning in healthcare, use of patient data to find patterns and prediction of new diseases, recognition of new diseases, risk management decisions, personalized treatments, and predicting the treatment outcomes are other uses of machine learning in healthcare. There is one use case which has been there is a tool which has been created by Google. The eye scans were done on 285,000 patients, and it was found that impending heart conditions and risks of heart problems were able to be identified using retinal scans. And this study showed 70% accuracy. And so there are many other studies which can be undertaken and improve the healthcare which can be accessed and provided to patients. So National Digital Health Mission, this was launched on 15th of August 2020. The goal was to provide healthcare data efficiently and safely to patients across India. Also, it is also called the Ayushman Bharat Digital Mission. The digital infrastructure is being created to support universal health coverage And leveraging open interoperable standards-based digital system is one of the functions of the National Digital Health Mission. So health ID cards, just like UIDAI, are being now will now be created at a very rapid pace. Telemedicine will be part of the will be made available through the National Digital Health Mission. DigiDoctor is actually the AI-based healthcare provider, and the Health and Family Registry will also be put in place. Actually, even the providers will be identified by a standard number, and therefore the Health and Family Registry will be available. The personal health records will be created and also will be the property of the patient to whom they belong. E-pharmacy is another service that will be available through National Digital Health Mission. So challenges to digital healthcare are actually absence of proper infrastructure and personnel. Data privacy and security concerns are very common, and the inequality in access is also a challenge. The devices, connectivity, technological literacy, all these things can actually can inhibit the use of technology. Information overload can cause healthcare to be basically the information overload actually can cause certain data which will be generated, too much data to be generated, and this will actually cramp or limit the use of digital healthcare. Ethical and legal issues, data ownership, consent, liability, all these things will also have to be looked at. And use of AI. Basically, the AI models should be transparent. They should not be biased, and there can be accountability concerns, because finally it is about sometimes vested interests which can cause these AI models to challenge pose a challenge to digital healthcare. So legal framework of digital healthcare in India. No separate law is there to recognize health data. Digital Information Security in Healthcare Act proposes to regulate privacy and security measures for health related data. Health Digital Management Policy by Ministry of Health and Family Welfare lays down the principles of health data protection. The purpose is to standardize and regulate the processes which are related to collection, storage, transmission, and use of digital health data, and to ensure reliability. All in all, digital transformation of healthcare is here to stay, and democratization of access to healthcare is the aim. Everybody should be able to access good healthcare. Benefits are much more than the risks and the disadvantages. In fact, UPI is a case in point, where now there is, payments have been totally democratized and speeded up. Similar revolution is needed in healthcare and will soon be coming. And healthcare of the future. So the healthcare of the future will entail continuous monitoring of health with built-in analytics and algorithm-driven emergency alerts and timely responses through use of IoT devices. Care should be shifting from hospitals to conveniently located retail clinics. And these are a part of the coordinated healthcare ecosystem. Connected homes and virtual care teams should be able to monitor continuously the health status of individuals, and the emergency responses could be triggered by the health status of individuals, which is being monitored by individuals in real time. Connected homes and virtual care teams would be the first point of contact to coordinate care and provide easy access to care in real time with reliable healthcare professionals. Access to personal health information and simplified processes for obtaining appropriate healthcare in the home setting is extremely crucial. Finally, the healthcare of the future actually is coordinated between the care settings. So there is coordinated care, the various healthcare data then triggers seamless financing, intelligent personal devices, help in and variables, help in decision support, personalized care can be instituted, and interoperable machines are also are accessible, and they feed into the healthcare system, and therefore this will contribute to robust decision support system. So basically, you can't stop the waves, but you can still learn to surf. Thank you. And now, if there are any questions, I would be happy to answer them.
Thank you, Dr. Sujata. I think it's quite elaborate, I would say, and quite exhaustive. Um, we have a few questions. First question is from Nayantara, and in fact, she wanted to know whether you would cover this topic in your lecture, but nevertheless, let me ask you. And her question is: authenticity of integrated apps need to be standardized by governing bodies. So, is something happening to that extent, Dr. Sujata?
So the thing is, as of now, there is not much standardization happening, but I'm sure with the National Digital Health Mission coming into operation, this thing will happen. For the moment, all of these are standalone apps, and they are obviously not at the moment talking to each other, and they are not standardized in any way.
And the next question is related to something that you are very passionately associated with, and that is about home care, Dr. Sujata. And I think you would have seen, you would have done a lot of research, you would have read, and you also would have visited some of the finest countries, especially those countries which are showing this extreme trends of aging population. For example, Japan is the biggest country where 1 in 10 person happens to be beyond 80 years, and the second country in the world happens to be China. Again, that is a looming large, and of course a few European countries, especially Germany and France. Now, when it comes to India, it's a much better as far as that aging is concerned. So, from that point of view, what do you think are the best practices that you have witnessed across the globe, and therefore, how do you think that's happening in India as far as home care is concerned?
So it is true that countries like Japan, like Europe, like China, all these countries are actually they have aging populations much beyond 80 years of age. But things are also changing in India, and it is actually likely that we will also need to bring in certain measures to make sure that that healthcare becomes a reality, and it is implemented, and patients are monitored at home. The data is transferred to the formal healthcare system, and without this, it is going to be very difficult for any country to actually finance their healthcare needs, whether it is India or Japan or what have you. We need to basically read the writing on the wall and get ready with answers with our with the healthcare systems which are interoperative, which are where the healthcare data is collected in the homes and then transferred to the formal healthcare system. It is only a matter of time when India will also need to do this. In Japan and these countries, it is well fleshed out. Their strategy for home healthcare is something that is very well established. And yeah. So yeah, India also needs to start thinking about it, though the problem is not that intense right now, but it is
Right.
going to happen in that direction.
Thank you, Dr. This is a question from Mr. Gopal Krishnan. And his question is, what are the steps to make digital healthcare equitable? That is, I know its reach in rural age groups and low income groups. Thank you, Gopal.
Right. So the thing is, today, what is needed is devices, access to devices, to technology, to connectivity, which will be required to make digital healthcare accessible to all in various environments. It is basically the all these things are at the moment, they are not equitable. They are still, there is, in the rural areas, people do not have access to full-fledged healthcare systems, digital healthcare systems, and to technology and connectivity. But this is slowly changing, and UPI, as we said, is a case in point. If it can happen in payments, it can actually happen in healthcare as well. In fact, our government is focusing on it and trying to bring about better access to healthcare through use of technology.
Thank you, Dr. Sujata. Maybe the last question for today evening is and something to do with, how do you, maybe one more question I have, and let me read out that question before we have the final one. This is a question from Mr. Yash Dadic, and his question is, there has been a lot of talk about orphan diseases and orphan drugs after introduction of rare disease policy. What are your opinions of digital solutions centered around rare diseases? Thank you, Yash.
Can you please repeat the question?
Yes, ma'am. There has been a lot of talk about orphan diseases and orphan drugs after introduction of rare disease policy. What are your opinions of digital solutions centered around rare diseases?
So the problem is that we have not yet actually been able to address problems of healthcare, where diseases which are much more common, which are lifestyle diseases, even those hold center stage, and to then go on to the orphan diseases and rarer diseases is something that will happen, but over time. I would say that today there are many other pressing issues. There is a larger population which is now needing healthcare to be accessed digitally, and this may not be the patients should be first, it is the time to first address needs which are of a larger volume, and then there are other needs which could be addressed.
Thank you. This is a question from Mr. Vinay Novel. His question is there any provision for proactive and predictive AI tools in digital health card to tackle large-scale lifestyle diseases, especially in urban areas? Thank you, Vinay.
So yes, slowly the healthcare, digital healthcare is actually making an foray, and patients are now being able to access healthcare sitting wherever they are, and it is there. But however, I would say a country like India actually has a large population, and this population actually needs to um, to um, to basically be able to address the needs of a huge subsection of society. This will happen, it is happening, but it will take time. Whether it is the healthcare diseases, which are the lifestyle diseases which are rampant in society, but with the digital highways which are being constructed by the government of India, it is likely that when the change comes, it will be rapid.
Thank you, Dr. Last question we have for you today, for today evening, Dr. Sujata, is that I think in January 2020, this year, January 2022, Goldman Sachs has come out with a beautiful report called as Affluent India, the rise of affluent India. That's the title of the report, where it categorically said how 4% of Indian population is actually growing rich, and that works out to about 60 million people. But there is also corresponding data, Dr. Sujata, that we have close to about 30,000 hospitals in the country, and most of these hospitals are catering to definitely the higher strata of the society. Now, therefore, the question is, how do you bridge and also other part of the story is that almost about 90% of this, India lives in, Bharat, or, the hinterland. So how do you bridge this gap in terms of the rich people having access to some of the finest facilities or healthcare facilities, and the so-called poor, where you have the sizable population, they don't have equal access. And therefore, do you think a digital healthcare is going to be a solution for that, or do you think we still have a long way to go?
Definitely, there is a long way to go. It is nowhere close to our complete access to healthcare in the rural populations. However, it is a beginning. There is digital healthcare is coming about, and more people are accessing healthcare using digital technology. It is going to come. It is already on the way. And though it will take time, it is not an easy solution, but I'm sure there will be solutions which are coming up, and patients will be able to access healthcare sitting wherever they are, whether in the rural areas or in the urban, high access areas. So yes, it will take some time. However, it is something that can be done using digital technology. There is no other way. And I'm sure that with the digital technology coming up, patients will be able to access healthcare in all locations, whether rural areas or where the actual Bharat lives, as you say. Yeah, it is not an easy. There's no easy answer. However, it is going to happen, and let us see how it goes.
Sure. And with your permission, Dr. Sujata, I'll take one last question. This is a second question from Mr. Vinay. And his question is there any roadmap in future reduction of health insurance cost, especially for middle class through digital health card? Thank you, Vinay.
So the government is doing certain things. There is a Ayushman Bharat scheme which is there, and they are trying to bring down the cost of health insurance and making the access to healthcare through insurance easier and better. However, again, the private healthcare insurance companies are so far not in a position to reduce the cost. At least they do not want to reduce the costs. And let us see how it pans out, because the government will have to come down on them, and will need to lay down the regulations for controlling and limiting the costs of health insurance.
Thank you, Dr. Sujata. Absolute pleasure having you. And once again, sorry to have disturbed you late in the evening from Hong Kong. But it's absolute pleasure, and especially the kind of canvas that you presented on healthcare, the digital healthcare part of it. Like you rightly said, while we are absolutely optimistic about the kind of changes that it can bring in, but I think everybody is aware, at least to the extent that we are of this participation, and also quite a few Indians in India. Right, I think we are making a quite deeper progress in terms of investments, in terms of innovations. Right, I think we are going to go there, if not immediately, but sooner there. But thank you so much, and keep making a difference. And happy stay in Hong Kong, and look forward to hosting you once again for another interesting topic in healthcare. Thank you so much.
Thank you. Thank you.
Have a great evening, ma'am.
Thank you.
Thank all of you. Thank all of you.